Welcome to Business Unleashed, a Plano Chamber podcast, your gateway to the dynamic world of business in Plano, Texas. Join us as we uncover stories, strategies, and insights that drive success in one of the nation's most vibrant business communities. Today, we're diving into an important topic that affects us all: mental health. In this episode, we have the privilege of sitting down with a true expert in the field. Our guest, Jeremy Hardy, brings over 14 years of experience in the mental health arena, and his dedication has helped grow multiple outpatient and hospital systems. But Jeremy's impact doesn't stop there. He's a passionate advocate for mental health and addiction treatment, serving on multiple nonprofit boards that address the pressing needs of our community. Without further ado, let's dive into this vital conversation. This is Mental Health Matters with Jeremy Hardy and Heather Wachman.
Welcome to this week's episode of the Business Unleashed, our podcast with the Plano Chamber of Commerce. My name is Heather Wachman. I am the Director of Development here at the Plano Chamber, and I am thrilled to introduce to you our guest this week. So the episode this week is actually very timely, but we will be talking about the importance of mental health and why mental health matters, not only in the business community, but here just in the Plano, Collin County region. So I'd love to introduce our guest today is Jeremy Hardy. So welcome, Jeremy. Do you want to give a kind of quick introduction to who you are to our listeners?
Yeah, well, thanks, Heather, for having me. We're excited to be a part of the Plano Chamber and be able to talk about this important subject of mental health and suicide prevention. I've been in the mental health field for about 14 years. I started and ran hospitals to day treatment to a lot of collaborative things with managed care insurance, and I also serve on the board of Mental Health America of Greater Dallas, as well as a few others kind of behind the scenes. Mental health advocacy is very important to me. And so we try and bring that in our business as well as to the community.
I love it. And I know I've gotten the chance to talk more with Jeremy in my role at the Chamber. So he has lots of experience. He has some fun facts about previous life, maybe before entering his current career field that we'll get into. I know you touched on it a bit, but I'd love to know just a bit more of you journey and, how you started and what you guys are kind of looking to do in the future here in Collin County.
Yeah, so like I said, I've been in the field for a long time, primarily working for hospital systems, so for corporate psychiatric systems. The problem there is there's a lot of barriers to get through to provide the kind of care that you really want to. And it's just the nature of private hospitals. It's just what it is. So myself, I'm actually an entrepreneur by trade, and I got into mental health by accident back after the housing market crash in 2008. But myself and my business partner, our CEO and co-founder, Samantha Castle, who also ran hospitals, and then our medical director and co-founder, Dr. Ayer, who also owns Prime Psychiatry, which that's also part of the chamber. We all collectively, going into 2020, we're kind of wanting to do something more meaningful, wanting to, and honestly, to do that, you kind of got to do it on your own. And so we had looked into different opportunities, and we decided, what if we were to do this ourselves? And one thing that we have that's unique is called lifestyle medicine. So there are a lot of what are called day treatment programs, called partial hospitalization, intensive outpatient. These are programs you go to 5 days a week or 3 days a week for a couple of weeks, intensive groups, those kind of things. The problem is groups and meds, and there's a lot of life skill, practical stuff in between that doesn't get addressed. And so therefore people get into a program, they get out, and it doesn't stick. So Dr. Ayer is one of the only psychiatrists in the world that is board certified in lifestyle medicine. And the short of it is, it's basically a total mind and body wellness model. And it's historically used for adults with chronic medical conditions, but he started using it in his outpatient practice for adults with addiction, what's called co-occurring, which means mental health and addiction disorders, as well as just straight mental health. We thought that was really intriguing because it really is the pure definition of prevention. So we all worked in hospitals, which is a reaction. It's a reaction to someone who didn't get the care they needed or you should have gotten. They end up in a crisis state, and then we, keep them stable, safe, and then hopefully they can de-escalate. We're trying to avoid all of that. What if we kept them at that base level? Maybe they need day treatment, but never end up having to go into hospital. So that's the model that we decided to go with. And specifically, we started out with teens because no one's ever done this ever in a treatment model ever in history. In a day treatment, providing things like yoga, breathing, mindfulness, food education, in addition to the groups, in addition to the medication as needed. So it really is, I hate to use holistic. It's more of just it's a whole body approach. It's top to bottom, inside and out. It's not just how are these meds making you feel? It's why are you doing this? What's your sleep like? What are your relationships like? In an industry, in a market where, yes, there's a ton of these kind of programs that are out there. And the problem is a lot of them, the recidivism is 3 to 6 months, meaning a patient, whether it's adolescent or adult, they're going through the program. But 3 to 6 months, they're having to go back into a level of care, whether it be inpatient or day treatment. Our first teens that went through our program, only 6 of them had to go back to any level of care. So we know that although we're pioneers, and some of these things, some things are covered by insurance. The ones that the parts of the program that aren't, we're covering that for now until insurance will allow us to. We decided to eat it because I've started companies and helped grow companies all over the country. We want to do something meaningful. So that's what we're doing. That's what we're doing here in the Metroplex. We've got locations in the Colony and in Plano. And so, yeah, that's kind of the origin of it. That's the why we did it, but it's also how we're doing it and how it's affecting not just our patients, or we call them clients, but also their families. If you don't address the families, and that's another thing a lot of these generic programs, they don't do. They do all the stuff for the patient. But if you think about one person in your household getting all this good care and all this good information, then they leave at 3:00 to go home and no one else has any idea or isn't bought into it, well, then it's just not going to work. It's not going to stick. So we address it with the families, whether it's an adult or an adolescent that's in our program.
Right. Which is huge. I mean, I think on a personal note, I've definitely had family members or volunteered with high school teens that have struggled. And I know you and I have talked a bit about it in the times that you guys have opened and then that we've seen you guys at events, but you made the comment, I believe it was during the grand opening, that for some reason, and I'm sure it has to do a lot with the stigma and just some of those stereotypes of mental health, but you mentioned, when you look at for example, the hospital systems, when it comes to mental health and what you guys are doing treatment wise, it seems to be lagging significantly as far as whether it's insurance, whether it's just the studies, whether it's the advocacy, what in your professional and also personal opinion is a big cause of that? Why is maybe there's still so much of that stigma and so much of that lag behind the public understanding the importance of mental health?
Well, it's a great question. And the answer can be kind of complicated. I will just say this, because there's a couple levels to it. One, of course, and again, this is me more coming away from the reflections guy. I'm going to kind of more talk on behalf of just the state of mental health in our state, in our country, and in our community right now. It kind of starts at the state level because, one thing about Texas, and if you look at us, I mean, at our socioeconomic is what I'm specifically speaking to. There's parts like Plano, for instance. I mean, there are parts of Plano that are very blue collar and lower. There are parts that are very white collar. Well, if you are at that point where you're on Medicaid, for instance, which does apply to obviously to our adolescents, to our 18 or 20 and younger, there are not a lot of services that Medicaid will cover, that they will pay for, and that is run by the state, that is funded through the state. In Texas, Now I will say this, there's actually representatives in our city in Plano that are doing a great job of this, trying to get the state to allocate more funds to preventative services and funding Medicaid, First Step and things like that. So that, because the reality is there are a lot of people moving into the state every day. There are plenty that are moving in this area that all can come with insurance. They all have money, they're well-to-do, but then there's also plenty that aren't. So on that side of it, on the kind of the folks that are underserved, that don't have the resources, that's always going to be an embedded problem. And anybody that's in our space understands that, especially as a private company, that's really hard because you want to address the need, you want to meet it. However, there's people like us, any hospital, outpatient, whatever, we exist because insurance reimburses us for care, right? Or people pay out of pocket. That's just the business side of it. You have to, that's how we get to exist. But in Texas, if you're needing that reimbursement from the state, unfortunately, the rates are, we're trying to get them higher so that we can provide that care. At the end of the day, though, I will say this, the state of Texas is doing more and more to address, because the state should be addressing this at a state level more. I've opened up hospitals in other states, and it's private companies like ours. They're the minority. They're not the majority they're not the primary care provider. So there's just embedded things about Texas. But I'll tell you, since I started in mental health and to the stigma and what they would allocate for resources, it has definitely increased tenfold since then. But we got a long way to go as a state. As far as the stigma, which ultimately that does end up being what it is, and this kind of even gets down to different cultures. There is the stigma to receive care. How can we get access to care? The good news is we're about to open up the largest state-funded hospital in this part of Texas. Is going to be going down there at UT Southwestern. It's going to be 200 beds, I believe. It's going to be for teens and adults, which is awesome because, you know, everybody deserves to have good care, regardless of their socioeconomic background. They deserve care. So there's the economics part. The other part would be, again, the culture. Now, what's interesting right now is that there are people moving in. So Collin County, where we primarily are all are, it's the fastest growing area in the United States right now, is it here in Texas and in North Texas. Well, there's 400 something people move here a day now. They're coming from New York, New Jersey, California, primarily, and several others. They're all coming, and here's the thing, though, there's other states that come here and they're used to having, you know, you talk at church, oh yeah, my therapist said this or my psychiatrist has me on this. Well, in Texas, we don't talk about it. We put out on Facebook, hey, everything's fine. I'm good. Look at my kid. Look what he did this weekend. Look at us. We had mom's night out. We went and did this and this, went to this movie, but nobody's actually addressed an issue. So the more people that move here that are used to that, it actually helps us, I think, as a community. So the stigma, it's still there though. It's still real. And you can just look at statistics. If it's okay, if I can go into a few of those, because it really does matter.
Yeah,
I don't know if you have a different section for that, but I'll because
no, that's okay.
Okay, so for everybody to know, the reality is no matter where you're from, what your background is, whatever your history is, 1 in 4 adults suffer from a diagnosable mental illness or addiction. 1 in 4, 1 in 5 adolescents. It doesn't matter. Again, this is everybody. There's no qualifiers here. That's everyone. And if you look at the amount of people that are here versus how many people are getting treatment or seeing a therapist or whatever, you can see the disparities. I mean, it's huge. So what it means is that, you know, the majority of people that need help aren't actually getting it. And it can either be because they have never been diagnosed, they've never seen somebody, they didn't feel like they should, they're scared to, maybe because of a position that they have in the community, or if they're an athlete or someone in their school. I will say this, even providers, people that are in the field, are healthcare providers. Doctors, it's so funny. Doctors are the worst about it. Doctors will prescribe all day long, but their own self or their spouse or their children. So yes, but that statistic is real. And I mean, so this month when we focus on suicide prevention, that's what we're talking about, acknowledging at the base level. The word prevention is so important. And so, but again, it is getting better. We're having more strides. You know, there's more nonprofits that are doing more events. We do suicide prevention walks. We do different things like that. But I mean, I know we're going to talk about business in a minute, but that's definitely a battleground when it comes to mental health.
Well said. I think something that you started to go into, and I'd love to maybe have you elaborate on that, is there are so many nonprofits, I think, especially in the Dallas County, Collin County area, that are focused on mental health awareness. That might look like those suicide prevention walks. That might look like a hotline for teens or for adults. So for you all, and maybe that's yourself, Jeremy, how do you guys kind of divide and conquer when it comes to getting involved out in the community, supporting organizations? What are you guys doing? And then maybe what would you encourage some of our local businesses to do to help support the cause?
So some things that we do at our company level. So for instance, we're in Collin County. Collin and Denton's kind of on the border, but so you have what's called LifePath, which are they're community mental health centers. These are the community mental health. So LifePath is who the state, helps fund for those that are either underserved or just, it's kind of the county crisis system. So we do a lot of support for them in sponsoring things and doing stuff in the community. Same thing with Denton County as far as their community mental health. So everybody in our space should be doing that at large. As far as other nonprofits, so, we support, so there's NAMI, which is the National Alliance on Mental Illness. There's NAMI North Texas. So they have education and they have services they do both for consumers, which we'll call like people with like chronic mental health conditions and their families. Then they do walks, they do different fundraising. So we support those, we sponsor those. But I also think too, even outside of nonprofits, are in the still the same vein, the school system. Schools, teachers, counselors, nurses. They're on the front lines of the mental health challenges for teens. And so we are really big about supporting, going to resource fairs, sponsoring events. We bring a lot of food and a lot of candy and a lot of treats and a lot of education for those. We do self-care trainings for teachers, like, hey, how do you look after yourself? How can you apply these principles of lifestyle medicine for self? Self-care is so important. It's kind of a buzzword now amongst the clinical community, but it's so not. So we advocate for that. So it's like, yes, we can help you with the people that you serve, but what about you? And so we do a lot of self-care, chair yoga. What can you do with it? How can you do breathing and mindfulness for 15 minutes, during the middle of a day, right after you get out of a parent-teacher conference that just does not go well? How can you handle all that? So we try and do those things too. We try and be as involved at the school level. We do a lot of student wellness fairs, which those are our favorites, showing them how to incorporate activity and lifestyle in with your mental health. how Red Bull does not, how can you have a different type of energy drink? What kind of fruits and foods? And so when you talk about supporting nonprofits and things like that, that's how we get into the community. We help support those that are supporting the community. That's really what we do. And I mean, there's a lot of other good ones. I mean, we do our best to also support or at least advocate or help promote those nonprofits that serve veterans, that serve homeless. We're always trying to be there. And as far as individually, like for me personally, like I said, I serve on the board of Mental Health America of Greater Dallas. I also serve on the board for Solutions North Texas, which is a substance abuse program nonprofit up in Denton that basically helps people that come right out of jail. How can they get into recovery and get back into the world? Other people in our company all serve in different nonprofits. And I think that's part of what it is. There's so many different opportunities for anybody. And the thing is that 1 in 4, 1 in 5 stat, what that means is that, and I see a therapist, I do.
Mm-hmm.
I've got, depression that due to family stuff that I've had to deal with. So none of us are immune. And it's either right. us or a family member or a friend. Heather, you and I had a really good conversation about that. Well, that's everybody. So everybody, whether it's themselves or a family member or a friend. So what that means is we all have a reason. We have a why that we should get involved. I have even helping advise other businesses and kind of in another part of my life. I always encourage them. I'm like, what are y'all doing as a community to both as yourself as a business, but also in the community? What are you doing to promote mental wellness? What are you doing to promote mental health and those kind of things?
Yes. I love that. I love that it really does, I think, resonate with everyone, whether that is themselves, whether they've had experiences with family members, all like friends. I mean, even those that maybe not the stereotypical, but like a single person living in Dallas or Plano, like who they interact with are definitely people that are going to face those challenges if maybe they haven't already. Or to your point, like, thank you for being brave and saying like, hey, that includes me. I go and speak to somebody because I've got some things going on. So I think that's another huge part of it is just knowing when and how to ask for help. And I know that you and I have talked about this and how to help get maybe some of those tips out to our employers. But outside of obviously what you guys are doing in the community reaches everyone, like you said. So what would you say are either like tangible steps or resources for those businesses in Plano that maybe don't have the resources that say like our larger corporate campuses do, right? Where they've got an HR team that is educated and well connected. Like what would you say to maybe those small business owners that just want to make sure they're educated and prepared to help their employees if that time comes?
Yeah, that's a really good question. And those are actually it's my favorite businesses to work with are the small to mid-size because, as you get larger, you have your EAPs, your employee assistance programs, kind of embedded corporate systems that a third party does provide counseling. But yeah, for your 5 to, 2, that's a big cost of the business. So a lot of them can't afford that. So I will say this, just to tease ahead on the spotlight that I did see of the questions, I did put some good information in there, like some tips and some links to that. So I would just say in general, to start at the crisis point, one good thing that happened. So there were these suicide hotlines. There were different things like that came out. But what happened at the government level that got instituted last year, we were part of the movement to promote it. So it is a number. It's a crisis number, and you can actually text too. And so we recommend that every business go find that literature. It's on a website. You can just print it off and just put it up around.
Stay connected with the Plano business community and follow us on social media for the latest updates and discussions at Plano Chamber. Together, we're unleashing the potential of Plano's business world.
Or if nothing else, I mean, it should be in areas that have access, like wherever the employee break room, or even if it's just something that is put out, once a month or something. Because yes, this is Suicide Prevention Month. This is when we kind of focus and highlight. But I mean, the thing is, mental illness doesn't take a holiday. It doesn't take a break. There's no ups and downs. It's always there. That 1 in 4 stat is always there. And so, that's one thing that I recommend, because then that's a great resource to kind of put that up. And then, because that's the easiest thing possible. It's 3 numbers. Bam, you can talk to somebody. And then I would also say that I think it's important that whenever people are doing orientations or you're doing any kind of staff training, that you don't have to say, hey, if anybody here is having mental health challenges or depression, anxiety, thoughts of hurting yourself or other, that's clinical, and people aren't clinical. You're a business, but you own a plumbing company. You're a 24/7 plumbing company, and you got 50 employees. Well, I mean, statistically, one of them or their family members, multiple of them have issues, if not you yourself. So I think there's a lot of good opportunity just to say a few things about, hey, make sure you're taking care of yourself. Make sure at home, what are you doing at work to kind of promote a positive mental mental health or a positive environment, and it could,
Mhm.
that's the thing. You think some of these things that people think are cheesy, it's employee engagement is really
Connectors.
important in saying, yeah,
Yeah.
and saying, just saying brief things like, hey, listen, everyone's mental health matters. All of our, because mental health matters is a good kind of general thing that you can say. Your mental health
Mhm.
matters. We want you to do well at your job, but we want you to be healthy long term, both physically and mentally. That's what we care about as so and so business. You know, and that's the thing, whether they say it or not, that makes
Mhm.
employees feel, it's not, because we all know statistically it's not about how much money you get paid. The statistics are, you want to feel valued, right? When
Mhm.
it comes to employee retention, you want to feel valued, you want to feel that you have room to grow, you want to feel that you're heard. It's not just, I want to make sure how much money I'm making. A way to feel valued is, hey, y'all, hey, care about your mental wellness. We have some resources here. Hey, today we're going to have a fruit bar because things like that. Or, hey, we're going to, I know that where there's a lot of Red Bull around here, we brought in a case of Celsius. Here's why vitamin B and not all these other things matter versus this. So there's a lot of ways you can do that, at your business level. But again, that's part of the resources I put into the
Mhm.
spotlight specifically for those people that don't have access to that can't just call the number that they were given it. And we work with a lot of those. We work with the Bank of
Yeah.
America's, JP Morgan's, all the ones that are in y'all's, that are in our
Mhm.
in Plano. But again, for the ones that don't, there's just as many resources out there. It's also important, I think, too, the insurance plan that the company has, because whether it's a marketplace because you're a small one, or whatever your insurance plan is, I think it's also important to make sure that your employees understand what the benefit is on the mental health side. Because everybody understands,
Mhm.
okay, here's my medical, my dental, my vision. But okay, of my PPO at Blue Cross, here's what it covers for mental health. Those things are really simple to say. And the truth is, whoever your insurance is, whoever's listening to this, your insurance provider that you have for your particular business, they have this information on the website. Especially, again, some businesses don't have a big HR department. They may have an HR person, or like me, when I ran a law firm once upon a time, I was the HR person. I was
Mhm.
also the AP and AR person. I was also the
Mhm.
whatever, because we only had 20 people. Well, your insurance has that information for you. So ask them for it. Say, what can you tell me about what is covered under the mental health, so that I can, in addiction, that I can give this to my employees, so at least they know. So yeah, that's a good tip, I think.
Yeah. I love that. And I think essentially the theme is that it's like you don't know what you don't know until you know, because there's so many resources out there. I think, again, you guys are attributing to the public education piece of it, which is huge, but a lot of that too is kind of taking the self responsibility to go ahead and start educating yourself as you start to know more and more how to advocate for yourself. And I know a lot of what you and I have talked about is that piece. I mean, I know you guys do great work with the larger corporations and out in the community and just your own personal experience. But with us coming out of, a pandemic where we've seen that really affect our teens, especially like those kids that have been in and out of school, what do you guys see as kind of the future for not necessarily just our teens? Because like you mentioned, our teachers and our parents that are in charge of those teens were affected. Like I don't know if trends is the right word, but like what do you see kind of coming up the horizon of maybe some pain points as far as like getting access to that healthcare, or just are we looking at needing to be more focused on those preventative efforts? What does that look like, I guess, here in the next 5 to 10 years from your perspective?
Well, one thing that the pandemic definitely did, it definitely accelerated people's mental health issues and crisis. People had to isolate, all those kind of things. One thing that did accelerate, though, that we were already a part of, which was the kind of the telehealth trend. That really wasn't done, especially in mental health. Like
It's true.
the only telehealth that was being done pre-pandemic for the most part might be, it was just starting to be popular to be able to talk to a PCP over a phone or through a teledoc thing. Well, because basically all the people that were providing care were having to be at home, and the people that still had mental health issues that needed to talk to somebody or needed medication were at home. So companies basically all just said, okay, we got to invest a lot of money into the technology so that we can provide telemedicine, telehealth assessments and all that. And what you see is like a lot of therapists, for instance, like your average therapist that, has a full client load that might have been in person. Well, a lot of them, now some of them stayed or went back to them, but what the average therapist now is about 50. And that's not just because the therapist wants it that way. It's that people got used to, okay, you know what? I can feel and be myself in this camera because I had to at first out of necessity, but I've gotten more used to it. And so I think that the prevention, and so more people are maybe, didn't feel comfortable, or maybe they lived in a rural area, or maybe they, didn't want to go into a place. I don't really want people to see me because I live in the city, walking into a so-and-so counseling, because it's in the same building as my pediatrician. Those kind of things still exist. But now if you're like, okay, wait a minute, I can access care without everybody knowing that I'm doing it. Okay, cool. I'm going to do that. So I think that's the trend that came out of it, was way more telehealth, way more telemedicine at all levels of care. I think that prevention is what's, in the future. In the past, especially in the mental health, when it came to mental health, there weren't enough outpatient and let's call them preventative measures. It was just all about hospitals. So it was like there's a huge gap between I'm not feeling good about myself. I don't really know if I need help. And I'm all of a sudden in an ER and I'm being brought to a hospital, either voluntary or involuntary. Well, since then, all these, like our programs, the partial hospitalization, the day treatment programs have come into place that help prevent that. Or if nothing else, people that are coming out of a hospital, they've got a good next step so that they don't end up going back. So those are some of the trends. But I will say this too, in general, again, without getting on a super platform, one, this crisis, the mental health crisis has out of the pandemic has definitely, let's just say, forced the government to go, hey, regardless of our stigmas, depending on what congressman or whoever you're talking to, especially when you start talking about baby boomers, you got to get into those, when you talk about mental health, you still got people that are in their 60s, 70s, 80s that still don't acknowledge that mental health issues exist. That's not for me. That's not me and my people, even though their wives are probably abusing pills because her husband doesn't want to talk about it. See, that's just reality. So as those folks kind of phase out and the younger, the Gen X, all these people are now in these positions of prominence and are saying, hey, no, mental health is a situation. It is an issue. So I think that's definitely it's almost like you kind of have to be an advocate now from the federal down. Because if you're not, you're seen as not addressing the real issues. And so I definitely think that regardless of how it forced everybody to be that way, I'm glad that it did. So I think preventative for sure, though, is the future. And I will say this one thing. We talked about resources a minute ago because I'd be remiss if I didn't say this. And it's not just because of who I represent and what we do. Yes, we are a for-profit business that provides mental health and addiction day treatment for adults and for teens. We're right here in the Plano area. Like we were talking about for small businesses and as a resource. So you have your suicide hotline numbers, but I want to make sure everybody understands we provide, and of course we don't want to be the only ones to, there's other people that do this too, but we provide a comprehensive complementary assessment. We do a levels of care assessment. And I'm only saying, and even let's just say maybe you're a business that, maybe you're part of the Plano Chamber, but you're nowhere near where we are. That's okay. Finding a place like that, there are places like ours that provide these complimentary assessments. It's a level of care assessment. It's with a master's level clinician. You kind of go through, okay, where are you at? Why are you feeling this way? Gets a good background from you. And then we recommend a level of care. And now a lot of those people do end up going into treatment, but if nothing else, and I would just say this too, you were talking about barriers earlier. I think one of the biggest barriers is up here in the stigma. What is it? The practical barrier is, okay, I don't want to reach out for help because now I'm going to be labeled. Or I tried reaching out for help when I was a kid, or I saw one of my friends reached out, and the next thing you know, everybody was in. A phone call is really simple for us too. I'm sure you'll put our information out there, but I mean, calling a place like ours, like Reflections, just saying, hey, I'd like to ask some questions. Here's what I'm going through, or here's what my spouse is, or here's what my child is, or here's what my coworker is. I'm not sure what to do about this, or this is kind of what I'm going through. I really need some help. Can I ask you a few questions about your program? That phone call is the first step. There's no obligation to a phone call. There's nothing there there's no pressure to a phone call. You're talking to an objective mental health professional. And so I think that's a really important message that gets missed a lot. We start talking about what treatment is and what it does, and we're talking statistics, but it can be very overwhelming. Where do I start? Just make a phone call. Just pick up yes, you can go online. Yes, you can do research. That's totally fine. There's so much information on the internet now when it comes to mental health that whenever you go to search something, the first, at this point, 15 things you see is because somebody's sponsored to show you their program. And they may be in freaking Malibu. They're not even in this area. So making a phone call to somebody local like us, because we just want to be a good local resource, regardless of how big your business is or what it is. I mean, we're going to be working with the city of Plano pretty soon. I used to in a former position. We just want to be a good resource for people just to reach out whenever they have a question.
Yeah. Which I think is hugely important and appreciated, definitely in the community as they start to learn more about that. There's two things that you touched on that, and even myself could probably be a bit better educated on. But when you say, like we've said, preventative measures or preventative tactics, I guess, like what do you mean, or what does like the industry of mental health mean when they say we're focusing more on preventative care rather than being reactive as we've maybe been in the past?
That is and this is kind of in honor or in recognition in the theme of suicide prevention. It basically boils down to prevention, meaning preventing someone being in a state that is acute or suicidal, meaning they're wanting to harm themselves, harm others, are highly psychotic, delusional, basically not of themselves, and they're going to do harm to themselves or others. That is the inpatient level. That's the thing that every ER has to deal with, and inpatient hospital. So that's what I mean when I say reactive, because that's okay. Oh my gosh, this person's in an ER, or they're calling 911, or their family is, because this person has a gun or is trying to do something to themselves, and someone has to intervene. Otherwise, they're going to try to, they're attempting to complete. That's what kind of the terms we prefer to use these days. That they're trying to complete, and so that's in the reactive side is okay. Being inside a locked in patient unit, or being observed in an ER bed. That's reactive. Preventative, that's what we mean by that. Preventing getting to that point where you are homicidal, suicidal, psychotic, where you're at that point that's called acute, where someone else is having to intervene to save your life. Okay.
Got it.
So that's what we mean when we say prevention. So I hope that answers that question.
Yeah, absolutely. It does. I think just to help our listeners understand that encompasses probably a lot, right? But what are we obviously working to prevent, which coincides with this month being Suicide Prevention Month. So yes, that was very helpful. And the last little bit that kind of coincides with that as well, but maybe the afterthought of, so obviously we're working to prevent those situations from happening, from losing anybody to that type of self-harm. Are there good resources, or maybe, and again, I know you've mentioned that you guys are obviously willing to be called and consulted, but if there are family members or friends that have maybe lost somebody to self-harm or lost somebody to suicide, are there resources for them? Like, are there things that you've just come across in your profession that you would also like to share with our group, if hopefully they do not ever need it, but just so our listeners have it?
Yeah, no, that's a really good question. We focus on suicide prevention, keeping people from, but the reality is, death by suicide it is and will always be in the middle of the top 10 causalities of death, and it's not going down, unfortunately. So there are resources and what we call them are suicide or survivors of suicide. When you hear somebody say survivors of suicide, that is someone who has lost a family member to suicide. And even the word suicide, like you could also throw in overdosing. Whether it was intentional or accidental, right. but a lot of that does come from someone that is self-medicating for their mental health, mental illness. So survivors of suicide. So that is actually something that does get recognized this month in September as well. I don't have the information in front of me now, but Heather, what I will do is, I don't know if you put notes into the podcast, I'll send y'all a link. Because it's the American, I think it is an association for survivors of suicide. We've worked with them here locally in North Texas. They're a very active group. And typically, so we will have these suicide prevention walks that, again, NAMI will do and several others. And so that's a lot of times that's where family members that have lost someone due to suicide will come out. They'll come out and support on behalf of the loved one that they did lose, because it's horrible to lose somebody that way, of course. But, but you have such a great opportunity if once you have, okay, now I can, we're going to honor their memory. How could we, instead of focusing on how we should have avoided it or anything like that, or all the, you go through grief counseling, you do that. And a lot of people have never done that, by the way. So if you have lost somebody, first off, you need to seek out a grief counselor, seek out resources for grief counseling, but then again, get involved. So like the American Society for Suicide Survivors, or Foundation for Suicide Survivors, they go to these events. They're very active. They go there and they have information about, because there are just simple messages like, you matter. You may think that no one cares about you. You matter. You make a difference in the world. And what a more powerful way to do that than to be somebody, a mother or a father or a brother who lost a loved one. To tell them, hey, this happened to us. I know for us, like motivation for us who work in the inpatient psychiatric hospital business for a long time, there are those that come in and they leave, and then you find out that they ended up completing, and that breaks your heart. I've just got a ton of people, unfortunately, that I've, doing this for a long time, can think of any time. And so it motivates me to, hey, I need to do what I can to be. Here's the thing, included everybody, all y'all too. We're either good or bad mental health advocates. And I think that's really important to understand. I say this to everybody I do new hire orientation. I have been for years at every company I've worked in mental health. And I tell everybody right away, you're all mental health advocates. You're either a good one or a bad one. And so, we all have a responsibility, because at these days and age, because everyone has access to social media, there's no one that hasn't heard about suicide or about mental health issues or about a famous person that took their life or a famous person that OD'd. We all know of this, which means we all have a responsibility. But what a worthy and honorable responsibility to say, okay, I need to be, and that's another thing too, the resources I put out on the spotlight, there's even questions that you can ask those around you. It's okay to ask people around you, how are you feeling? It seems like you've been really down lately. Are you having any thoughts? See, a lot of people think, oh, they're going to cause, if you ask them if they're feeling like they're going to hurt themselves, they're going to hurt themselves. Let me just tell you, that's one of the oldest incorrect things ever. That is the pure definition of why we need to overcome the stigma. Everyone should be asked. If you have concerns about anybody around you, you should ask. Because the worst thing they're going to do is just not answer you. But I've got so much data, statistics that we all have poured over that show how much crisis gets prevented just because someone or a coworker just reaches out and say, listen, I noticed you've been coming in late like almost every day and you come and you look like you haven't really been sleeping. Are you doing okay? Can I help you get to talk to somebody? And I'll tell you, those kind of questions, they really matter. So that's not just suicide prevention. This is how we prevent things. We ask questions, get out of our comfort zone. You see somebody posting something on social media, giving stuff away, or a lot of hopeless, helpless type thoughts. It's so easy to not want to get involved, right? It's so easy because you can, oh yeah, I've got enough issues on my own. I've got enough, I'm going through a divorce and I don't really, well, the thing is though, we all have that responsibility and anyone that has intervened in someone's life and seen them do better after can tell you, it's worth it. Every time you do it, it's worth it.
Love. And I agree with it all. That's I think my biggest takeaway is from this conversation is we're all mental health care advocates. We are either really good at it or really bad or maybe somewhere in the middle. So yes, is there kind of as we wrap up, I would love to just know, that's my takeaway. Is there anything that you want our listeners to walk away with? If it's not one thing, two things, just from this conversation that they can take out back to their family and their community.
Yeah, I would just say that, if you have an issue and that I would even just start with yourself.
Mm-hmm.
It's so easy to look to everybody else in your life and not to look at your own situation. But whoever is listening to this, if you're an employer, you're responsible to your employees and your family first and your employees. Regardless of where you're at, you have other people in your life who you're responsible for. So, make sure that you're taking a look at yourself, because a lot of people, it's the thing about when you're on the plane, how they always tell the mother, hey, make sure that you put the oxygen mask on you first and then put it on your child. Well, that's a good application for our mental health. It's, we spend so much time helping other people, and then we're going to be the ones that ends up in the hospital because we're not taking care of ourselves. And eventually, if you don't deal with your issues, eventually they're going to surface some way or another. And so I would just say, bottom line is look to yourself, look to the person next to you. That's super important.
Jeremy, we are so thankful for you. Thank you for bringing all of your expertise and your knowledge, and just letting our listeners know a bit more about what they could be doing, or maybe just how they can better take care of themselves.
Thank you for joining us on this important episode of Business Unleashed, a Plano Chamber podcast. We hope this conversation has shed light on the critical topic of mental health and inspired you to take action in your own community. A big thank you to our guest, Jeremy Hardy, for sharing his insights and experiences. His dedication to mental health awareness is a testament to the positive impact we can all make. As we wrap up, remember that mental health is a shared responsibility, and working together, we can create a more compassionate and supportive community. If you found this episode valuable, please consider subscribing, rating, and leaving a review. Your feedback helps us to continue to bring you meaningful content. Stay connected with us on social media and visit our website for more resources at www.planochamber.org. Together, we can make a difference in the mental health landscape of Plano.